Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Science, Coimbatore. Today we are going to see a topic on surgical terminology and intervention, which comes under Introduction to Surgery and Central Sterile Supply Development. So first one is incision. Incision is an opening of a skin or making a cutting on the skin. It is an operative procedure, starts with incision of skin, subcutaneous tissue, fascia, muscles, peritoneum or a pleura to visualize an organ. Next one is excision. It is cutting of a pathological tissue. Next one is extirpation. It has a multiple meaning, which one is elimination of a species from the specific area or a surgical removal of a disease. For example, it's a tumor. And some pathological terminologies have been mentioned here. Otomy is a term which is used along with other words, meaning it is opening of a body cavity. For example, it's a laparoscopy. It's a cutting of opening. And ectomy means removal of an organ in a part or a total pulmonectomy. Next one is stomy. Stomy is a communication or an opening or a permanent temporary type between the external and the environment and the body cavity. Next one is resection. Resection is a removal of an organ with respect of corresponding vasculature. For example, pulmonary lobe resection, liver resection. Enucleation. It is a surgical procedure that involves removing of an organ or a tumor in a clean, whole manner or a removal of an eye. Next one is exhalation. This is a removal of a pathological process within its capsule which remains. It comes under a microbiological and a pathological tissues where this exhalation process has been done. Next one is amputation, which is removal of an organ or a body part such as limbs in which whole or a part of a limb has been removed. It occurs because of an road traffic accidents. And here I have mentioned some type of interventional procedures based on the timing and based on the purpose. So based on the timing, it has been divided into an emergency or urgent case where the surgical procedure is done to a patient where the condition is very life-threatening and immediate action is required to save their life. Next one is elective or planned procedure is something which is scheduled in advance and the emergency complication is very much reduced. So based on the purpose of the surgery, it can be a reconstructive surgery, it can be an amputational surgery or a cosmetic surgery. Other types of surgical interventions are radical surgical procedure, which involves a removal of a pathological process in its entirety. It is a form of surgery where it is a definitive surgical cure that may contain a cancer. Next one is a palliative surgical procedure in case where the general condition of a patient or the nature of a disease does not allow use of an extensive radical procedure. They need some type of palliative surgical therapy for a certain period of time. Once the palliative surgical is done and after the late period, after 1 or 2 years, the radical surgical procedure can be performed without any complications. Next one is reconstructive surgery, which involves a vitality and function of an organ has to be maintained once this reconstructive surgery procedure has been planned. There are various types of reconstruction surgical procedures. One is reparative surgery, one is implantation surgery and another one is transplantation surgery. So reparative surgery in the sense, example of plastic and orthopedic surgery where there is an reparative of certain tissues or a congenital disorders or a deformities or a fractures can be done. Implantation means something artificially has been implanted into the patient body, which can involve the pacemaker. Next one is transplantation surgery is the highest step of a high risk procedure where the organs from one person or a cadaver has been transferred to the another person. Here I have mentioned surgical interventional technologies that we can do in an abdomen, and here are the various types of incisions here mentioned. Kocher's incision, Mercedes-Benz incision, midline laparoscopy, para-midline, transverse, Rutherford Morrison incision, Grignard incision, Lance incision and Feinstein incision. Each incision has these unique types and unique need to visualize an organ in an abdominal cavity. Cardiothoracic surgery, which uses a sternotomy as an incision technique. So the incision is made in the middle of the chest and the two sides of the sternum are separated and clear visualization of the thoracic cavity can be done to see the organs. Another form of cardiothoracic surgery involves posterior lateral thoracotomy. It is an incision which is placed in the back to access the chest and is often used in the thoracic cases. The purpose includes a pulmonary resection, chest wall resection, or esophageal surgery. The access to this is, you can see the lungs, you can see the hilum, mediastinum, trachea and esophagus. Next form of cardiothoracic surgery involves anterior lateral thoracotomy. It is a surgical incision that routes access to the upper lobe, right lobe and the anterior hilum of the lungs. It can also be used in the cardiac cases and the esophageal procedures. Next form of the surgical technique involves axillary thoracotomy. This procedure involves making an incision in the axillary region of the chest to access the upper limbs, apex of the lungs and the posterior hemithorax. It is often used in general thoracic surgical procedures. Next form of the thoracic surgery involves bithoracotomy. It is a surgical procedure that makes an incision in the chest wall to access the thoracic cavity. It is used to diagnose or treat the illness in the chest such as lung cancer. During a thoracotomy, the surgeon can see and take a biopsy of the lungs, heart, aorta, esophagus and possibly the spine. Thoraco-phrenico-laparotomy. It is a surgical procedure that involves visualization of the thoraco-abdominal aneurysm to repair and to open and to see the graft placement with reattachment of the aortic branches. Finally, we are going to see about mixed and minimally invasive cardiac surgery, which involves a machine. It is called as Da Vinci system. Is a medical procedure is defined that is carried out by entering the body cavity through a skin and through a body cavity through anatomical opening or with the smallest damage that is possible to these structures. So these involves like making a small hole directly on the patient chest wall rather than opening a conventional sternotomy methodology to visualize the heart through a camera and through a robotic surgery to access the damage and to cure it. Thank you for listening. Hope you understood this topic.